Hello everyone, you're listening to Lisa Wheeler from Embracing Health. As many of you know, I work as a consulting naturopath for Hippocrates Health Centre of Australia. It's a raw living foods detoxification retreat, and I have for many years had a special interest in disorders of the endocrine system, most especially thyroid and adrenal problems, as I've suffered from troubles in those areas myself. In doing a lot of study and research into finding out what it takes to get well from these conditions, my journey led me to the work of Dr. John Lowe, one of the world's foremost experts on fibromyalgia. He has authored the impeccably researched clinical resource, The Metabolic Treatment of Fibromyalgia. He's co-authored Your Guide to Metabolic Health, and he's the Director of Research of the Fibromyalgia Research Foundation. He's also authored or co-authored more than 150 papers for scientific and professional journals. I'm very pleased to have Dr. Lowe join us today to talk about his research and his successful treatment programs for fibromyalgia. Welcome, Dr. Lowe.
Oh, thank you very much, Dr. Whitmer. May I ask you, is it appropriate to refer to naturopathic physicians as doctor in Australia?
No, actually. No, we're just known as naturopaths, and doctors are reserved for medical practitioners only, yes.
Oh, okay. Well, it varies in the United States, as you may know.
Yes.
In one state, I am a chiropractic physician. In another state, I'm a chiropractor. But it varies and varies and varies, so I just never know. So, okay.
Yeah, it does.
We'll have to have you on the show anyway.
Yeah, excellent. Well, we might just start by explaining to our listeners a bit of an overview of what fibromyalgia is and what symptoms someone might be suffering from if they've been diagnosed as fibromyalgia or similar conditions.
Well, the two distinguishing features, if you eliminate all the others that are associated with what we call fibromyalgia, is widespread chronic pain. And for a quantitative number, that's usually the duration of the chronic pain is usually given as at least 3 months, and abnormal tenderness. But there always is given a series of associated symptoms that include virtually always chronic fatigue, stiffness, especially early in the mornings, that lasts more than 15 minutes. For some people, it lasts up for a couple of hours. Depression, non-restorative sleep, poor memory and concentration, a sensation of swelling, cold intolerance, abnormal sensations such as numbness and tingling, anxiety, headaches, in women, menstrual abnormalities, usually profuse bleeding during the menstrual period, and dry skin and mucous membranes, irritable bowel syndrome, usually involving constipation. There may be other symptoms too, but those are the ones that patients most prominently report.
Yeah, so it's quite a number of symptoms, isn't it? It's quite a big list, and I guess a lot of those symptoms are becoming more and more common in today's society, whether they're diagnosed as fibromyalgia or not. So how did your interest in fibromyalgia come about, and what did your early research uncover?
Well, I began working with fibromyalgia patients when I realized that there was a small percentage of my patients. I did specialize in myofascial trigger point therapy as a neuromusculoskeletal practitioner, and that therapy is extraordinarily effective. And a lot of physical therapists and massage therapists and other, in the United States, a lot of naturopathic physicians also do myofascial therapy, and it's extraordinarily effective. And there was a subset of patients for whom it didn't work very well. In fact, it made them, a lot of them, even worse. And I became obsessed with what was wrong with these patients, and it led me, as I pointed out in the magazine, it's the largest magazine here in the United States, Fibromyalgia Aware. The issue hasn't come out yet, but that started me on an odyssey that hasn't ended until this day.
Yes.
What happened initially is that In 1987, I was treating a patient who had these symptoms that we would describe today as fibromyalgia. And back then, the condition was called fibrositis. And I sent her to a medical internist I worked with who diagnosed her as having hypothyroidism. And I had treated her maybe 20 times with myofascial therapy, muscle and connective tissue therapy, and gave her brief palliative relief. But after she began taking thyroid hormone, she responded to a couple of treatments, and that was it. I released her. And I was so fascinated with her case that I wrote a case report on it for a journal.
Yeah.
And that began my publishing in the field, and it started in 1987, 1988. But that, as I began trying to figure out what was going on with these patients, I communicated with other researchers and other specialists in myofascial therapy, such as Dr. Janet Travell, who was, some people may remember her as President John Kennedy's White House physician. She had gotten him out of pain, low back pain, when he was a senator so that he could run for president. And when he became president, he made her the first female White House physician. But she was very elderly, and she was well aware that myofascial pain, chronic myofascial pain, can be underlain by hypothyroidism. And it was essentially reading her work that really got me doggedly pursuing a possible relationship between too little thyroid hormone regulation and what we called fibrositis, fibromyalgia, as of 1990. That's how it started.
There's not many doctors that really have put the association together, I see. I mean, I know in your book I had to laugh where you say this is an approach to diagnosis in which the doctor uses his or her intelligence in a process of rational judgment. This approach is largely absent from modern mainstream medicine. And I see that quite a bit where the symptoms are ignored in favour of the blood test. And I have to agree there's often an alarming lack of common sense in the medical profession. I had one patient come in myself with a very large goiter. So she had a huge swelling out of one side of the neck. It was very obvious. And she had many, many hypothyroid symptoms, yet her doctor had told her that a thyroid test had come back fine, so there was nothing physically wrong with her, and referred her to a psychiatrist. So this sort of thing happens all the time, and I'm sure you've got hundreds of similar incidents where the connection hasn't been made between the symptoms of the patient and the condition.
Oh, definitely. A very unfortunate thing happened about 40 years ago, and that is that the TSH test that most doctors concentrate on and find very convenient because it's supposedly simple to interpret, and you can eliminate the possibility that a patient has hypothyroidism with it supposedly. But what happened is some researchers around 1971 in earnest found that they were really looking for how to help thyroid patients, hypothyroid patients, and they found that in many patients that test was what they considered abnormally low. When they compared it to people in general, and then they compared within patients using thyroid hormone, the level was much, much lower. So they assumed that since the test, the level of TSH was higher in people who didn't have hypothyroidism, that patients with hypothyroidism suppressing their TSH levels were taking too much. And they sent out word to doctors the world over to cut their thyroid patients' dosages in half. That began the appearance of chronic fatigue syndrome, fibromyalgia, and so on and so forth, atypical depression, variety of gynecological problems. And unfortunately, it became very profitable for corporations who manufactured that test to sell it to laboratories, and